Hello YouTube, we're pediatrician brothers.
Hello.
Today we're going to talk about breastfeeding, but before we move to anything else, let's touch upon the advantages of the breastfeeding.
Yeah, before we mention anything, we should say that breastfeeding is unique and irreplaceable thing, both composition and cost-wise. So to start with composition, proteins in the breast milk is whey dominant, so the whey and casein ratio is 60-40. And also proteins are rich in alpha-lactalbumin, which is also important.
Breast milk also contains beta-lactose, which is a prebiotic and very important, a lot of polyunsaturated fatty acids, and beta-palmitate, which is good kind of palmitic acid and very important for normal functioning of the organism. We should also mention that there are a lot of vitamins in the breast milk, and they are way more than in normal cow's milk, right? For example. And we should also mention how it affects the immune system.
Yes, according to the current data, we know for sure that the children who are breastfed are getting less infections like otitis media, urinary tract infections, respiratory tract infections, diarrheal infections, and etc. They also suffer less from the allergic issues and also chronic diseases. Okay, so to summarize these facts, we should offer the breast milk as soon as possible, as much as possible, because it is the best thing that we can do for the child.
Yeah, and we as pediatricians always promote breastfeeding as much as we can.
Yeah, that's why CDC recommends to breastfeed the child for at least 12 months, and WHO recommends to feed the child even until 24 months.
Yeah, and we should say that you can exclusively, in some cases, feed just breast milk up to 6 months. There are three main things that we need to explain to parents when we talk about breastfeeding, right, David?
Yes, the first thing is how often should we feed the baby?
So we tell parents to feed as frequently as possible. Most of the babies make 2 to 3 hour intervals, which makes it 8 to 12 feeds a day, right? However, we do not recommend observing any type of specific routine, rather observing the feeding cues that you notice with your baby. The feeding cues are as follows, right? Rooting, sucking fists or fingers, baby being fussy, and if we do not notice these cues, then in the end baby will start crying. Frequent feeds help with prevention of constipation and the easy passage of the stools. David, what is the correct technique?
Yes, here we should pay attention to the correct positioning of the child and the mother, and also correct latch of the baby. So on the pictures here, you will see the correct positioning and correct latch, which would help you to promote the successful breastfeeding. We should pay attention that breastfeeding process should not be painful, and during this process also you will hear the swallowing sounds of the child, okay? After breastfeeding, the breast should feel lighter, and of course the baby should be satisfied and also not fuzzy and irritated. There is also a question that we get a lot: how often should mothers empty their breast?
They should empty the breast as frequently as possible, both breasts as frequently as possible. It promotes successful breastfeeding and lactation, and also it will prevent complications that might be attributed to the engorgement and etc. Mothers who have excessive breast milk, David, have concerns about the storage of the breast milk. What are the techniques and how long can we store the breast milk?
Yes, it is a good question. If we put the breast milk into the freezer, it can be stored for at least 6 months. And according to certain trials, if we have a freezer at a certain temperature, it could even be stored for 12 months. However, the best option is to store the breast milk in the freezer for 6 months. Outside the refrigerator, we have easy rule of fours. At the room temperature, you can store the breast milk for 4 hours, and in the refrigerator, if you have at least 4 degrees in the fridge, you can store it for at least 4 days.
Thank you for watching the video. Please subscribe to our channel, like the video, and also comment if you're interested in any specific topic.
See you later.